Hey guys, Dr. Z here. I want to talk to you about peptides. It seems like every few years in the medicine and healthcare space, there's the new hype topic, and it's definitely peptides these days. And like with everything else, lots of good information out there, way more bad information out there, people doing all kinds of stupid things. So let's just simply talk about what peptides are, some of the common ones that you might have heard of, and we'll go from there. So, firstly, just to understand, peptides are not a new thing. It's a category of molecule. Insulin is a peptide, Ozempic is a peptide, and these unlabeled vials that people are getting from God knows where, they're also peptides. So the right question isn't really, do peptides work? That's like asking, do pills work? Obviously, the real question is, does what's inside the particular peptide or pill work? So when it comes down to what a peptide actually is, it's simply a chain of amino acids. Amino acids are basically the building blocks that the body uses to make proteins, and peptides are shorter than proteins, but there's no necessary cutoff between the two. For example, insulin is 51 amino acids, and it often gets called a peptide or a protein, doesn't matter. Bottom line is, a peptide is a chain of amino acids. Now, these amino acids are everywhere in your body, and your body uses them as signals. It tells cells when to release hormones, how to control blood sugar, regulating appetite, constricting or dilating blood vessels, all sorts of stuff. And you can imagine, because of this, this is what the danger of unregulated peptide use is. People use it for a certain thing that they think it does, but it has effects potentially all over the body, and effects that you likely don't want happening. To break it down very simply, what a peptide does is it's going to act on a receptor which is connected to a cell, and it's going to tell it what to do. It's going to carry a signal, and then that cell, based on the signal it receives, is going to do something. Like the many things we talked about, it's going to increase sugar levels in the blood, it's going to decrease them, it's going to dilate the blood vessel, it's going to constrict the blood vessel, whatever that particular peptide is, whatever that particular receptor and that cell is. And this is the magic of peptides. A very small dose, if it can find the right receptor, it can do a very specific action with minimal side effects. And that's where the science is fascinating and why these are potentially so useful. However, as I said, if it's binding receptors you don't want it to bind to, or if it's sending signals that you don't want it to, that's exactly why peptides can also be very dangerous. And let's address another thing here. A lot of people seem to have this idea that just because peptides are synthetic or they're made in a lab, that they're a bad thing and they're not natural in the body. This idea of natural being automatically a good thing is incomplete and sort of childish. Insulin is natural, and too much of it can cause seizures, coma, and death. Growth hormone is natural, and too much of it can cause abnormal tissue growth, cancer, joint problems, heart attacks, you name it. So just because something is synthetic and made in a lab does not necessarily make it a good or a bad thing. And now you understand that all it's doing is connecting to a specific receptor and sending a signal to a specific cell, telling it to do a specific thing. Now, another thing you might have noticed about a lot of these peptides going around is that they're all injectable. And the reason for this is that anything that you take in orally, your GI tract, is built to break down that protein into fragments so that your body can absorb it as nutrition. That's why a lot of these peptides are injected subcutaneously to bypass the GI tract. And as I mentioned before, peptides as a class are not a new thing. There are plenty of real, legal, beneficial peptides that have been used for a very long time. We talked about insulin for diabetics, the GLP-1 receptor agonists like semaglutide or Ozempic, GnRH analogs like leuprolide that's used in prostate cancers and some kinds of endometriosis. Octreotide is used for certain neuroendocrine tumors. So this is not a new thing. It's just certain types of them that are being hyped up and now catching mainstream, because there's certain superficial benefits like weight loss and tanning and stuff that we'll talk about that more and more younger people and mainstream people on social media have become interested in. One of the most common names that you'll hear about is BPC-157. It's one of the most heavily marketed recovery peptides in the world. It's basically being sold as a tendon and ligament injury panacea for joint pain, muscle tears, gut problems, surgical healing. And often you'll see people are using it with TB-500 and calling this the Wolverine stack, after the X-Men character. And there is significant preclinical literature that does show a lot of data for this peptide. In animal models, BPC-157 promoted blood vessel formation, nitric oxide signaling, and activation of fibroblasts, which does appear to accelerate tendon and gut healing with a mild toxicity signal. And that's real science. It's a legitimate reason that makes this peptide very interesting. But the problem is the human data is still lagging. There's 3 main published studies, and they all came from a private clinic group, the same one in Florida. None of them had a placebo group. There's fewer than 30 people that were studied in those studies. For example, one of the studies done in 2021 was a retrospective chart review, which on its own is not a very strong type of study when it comes to levels of evidence. And it compared 16 people with chronic knee pain. 12 people received BPC-157, and 11 of them reported improvement. And the other 4 got BPC-157 along with thymosin beta-4. Again, no control group, no randomization, no blinding, no standardized pain scores, none of these things that make up a very stringent, strong study. And as of right now, this peptide has not been cleared for human use. There's no certified study showing that this is good for humans. It certainly hasn't been cleared by the FDA or these governing bodies. So all this use that you see are people basically just independently buying it from questionable sources, and it's very dangerous. Now, does that mean BPC-157 is a bad thing or peptides like this are a bad thing? No, not at all. There's definitely interest there. There's definitely reason to study it further, but these things take time. The danger is if it has effects that we don't know about and people are using it from God knows what source and what it's laced with and what they're actually receiving and putting into their body, that's where the danger happens. So please be very careful. You're an adult. You're going to make your own decisions. I get that. But be rational and be patient. Don't fall into these social media traps and what other people are doing. The body is a very complex piece of machinery. And even though all these things are very interesting, it takes time to make sure that it's safe for human use. The FDA at this point has said that it has insufficient safety information to determine whether this peptide can harm humans. Health Canada listed it amongst unauthorized injectable peptides. So in summary, it's very interesting, but it is not a proven human treatment as of now. I hope that changes. I hope we get more studies and we'll see. But again, this channel is what the latest guidelines and the science say, and that's where we're at. At the end of the day, you're an adult. You have your free will. You're going to make your own decisions. This is not medical advice. It's just education. But just generally speaking, ordering stuff from TikTok and injecting into your body seems pretty idiotic on the whole. TB-500 we spoke about. This is related to a fragment of thymosin beta-4, which is a naturally occurring molecule involved in cell migration, blood vessel formation, and tissue repair. And basically, this is being marketed as healing, flexibility, recovery, reducing inflammation. However, as of right now, the FDA has not identified any significant human exposure data, and there's concerns about immunogenicity, aggregation, as well as impurities, because again, all these peptides are for now coming from unverified sources. We don't know what's in them. Just because a molecule can influence repair pathways in a petri dish doesn't mean it can necessarily do that in a human being. And again, the more concerning thing is it can stimulate those pathways in a tissue where you don't want stimulation. And when you have uncontrolled growth, that's where things like cancer happens. CJC 1295 and ipamorelin, these are related to growth hormone and the ghrelin receptor. And basically the marketing promise is lean muscle, fat loss, better sleep, faster recovery. And when you look at the evidence, again, not very much. In the limited human trials that there are, it did show that growth hormone and IGF-1, which is another type of marker, did rise for several days. And basically that proved that it does change hormone levels, but that does not automatically prove that altering these levels improves longevity and performance and all the other things that it's promising. Just because a blood test temporarily says something does not mean that there's actually a clinical benefit. And again, when it comes to complications, the FDA has reported increased heart rate, vasodilatory reactions associated with CJC 1295. And for ipamorelin, there was a published intravenous study that included serious adverse events, including death, although it doesn't necessarily mean it was directly related to that drug. All sorts of issues arise when you have too much growth hormone in the body: fluid retention, swelling, joint discomfort, reduced insulin sensitivity. So these are not things to just play around with. Melanotan II basically stimulates melanocortin receptors and darkens the skin, effectively giving you a tan. And the studies have shown complications in its own right with appetite, sexual function, and blood pressure. There have been FDA studies and case reports involving melanoma, encephalopathy, priapism. And again, these case reports don't necessarily prove causation where this drug specifically caused that outcome, but it's just something to be mindful of. Retatrutide is another popular one, and this one's interesting because it's actually being properly studied. It's currently in phase 3 trials for obesity and metabolic disease. And it's similar to sort of the Ozempics and all that stuff, but it's a different class. It activates GLP-1, and glucagon receptors. And in the trial so far, it has shown substantial weight loss. As of right now, it's not authorized in Canada or the US, but this one's genuinely exciting. It actually has real data to support it. It's being worked on, and it's definitely something to keep an eye on. But again, as of right now, it's not legal and it's not through official compounding pharmacies. So whatever use you're seeing, people are getting it from random sources. And this is not meant to be some kind of lecture to tell you don't do this, don't do that. Like I said, it's not medical advice. It's just going over the latest guidelines and the literature and the evidence. I'm not against peptides. I think as an idea and as a concept, they're great. I think there's going to be a genuine role for them moving forward in medicine, but it's important to be rational. It's important to be patient and don't inject things into your body because they're popular on your TikTok algorithm. So now let's talk about what these countries are actually doing and where we're at currently. So in the US, these compounding pharmacies, they operate under Section 503 of the Federal Food, Drug, and Cosmetic Act. So to compound with a raw ingredient that's not an approved drug, that ingredient has to be available on the 503A bulks list. And then they basically categorize these items into stuff that can be used while it's being studied, things that have significant risks, and things where there's no evidence. So BPC-157, for example, was a Category 2 back in 2023, which means functionally you're not allowed to compound it. And then in April of 2026, they removed BPC-157, TB-500, CJC-1295, and a lot of other ones from Category 2. But again, that doesn't automatically mean that just because it got removed from Category 2 that it's now all clear and good to go. It's still a work in progress. And then late in July, there's the Pharmacy Compounding Advisory Committee in the US that basically voted for 6 peptides to be available through compounding pharmacies. So things are moving, but they're a work in progress. Nothing is set in stone yet. None of these have been made legal. None of these have been approved for anything. It's just something worth keeping an eye on. Just because the advisory committee voted a certain way does not mean the FDA has to do one thing or another. They'll make their own decisions until it's actually placed on the compoundable list with a formal notice. We're not there yet. Even after it's approved for compounding, that doesn't mean that it's an approved treatment for any particular condition. So again, lesson of the day is these things all take time. And in a TikTok shortened attention span world, that time feels like forever. And in Canada, unfortunately, as usual, it's lagging way behind. There is no similar vote. There has been no significant updates as of right now, like there was with the FDA. Health Canada has not done anything in that regard, and there's no advisory vote or anything to report on at this point. So pharmacies are not allowed to compound these peptides. There's a lot of illegal use, and the Canadian authorities have seized a lot of these peptides, and basically Health Canada has advised Canadians not to buy or use these unauthorized injectable peptide drugs, which, common sense, again, buying something from a TikTok site and injecting into your body is pretty foolish, regardless of what it is. Now, as far as the risks, obviously each of them have their own specific risk profiles, but broadly speaking, like we talked about before, the peptide acting where it shouldn't. If it's causing cell growth and differences with sugar levels and doing things and acting on receptors it's not meant to act on, sending messages it's not meant to send, that's where we get things like cancer, side effects like nausea, vomiting, headaches, and even cardiac arrest or death. That's, broadly speaking, one of the major concerns with these peptides. The second one is we have no idea what the long-term risks are because a lot of these peptides are newer and there just hasn't been enough time to study what the long-term effects are. A lot of them haven't even been released for use in the first place, so it's going to be a while before we understand, looking back, what these are actually causing in terms of side effect. And the third, at least for now, and arguably most importantly, is source control. A lot of these people that are using these peptides illegally, we have no idea where they're coming from, what they're cut with, what else is in there, and those things on their own can have a lot of side effects. So the bottom line is that peptides as a whole are very real. There's real science there, there's real biology and very valuable, useful medications already. In my opinion, peptides are going to be huge. They're going to make a huge difference in our ability to prevent disease and treat it faster and better when people do get it. However, there's work to be done. Please do not buy anything just because it's popular online and inject it into your body. Let the science do its work. Be patient. Wait for the evidence. Let these authorities do their work. Be very careful with whatever you're using. Speak to your physician. Get checkups, get blood work, monitor for side effects. There's work to be done here. It's a very interesting area, but we have a long ways to go. So I hope that was helpful for you guys. Be sure to check out the newsletter and the community in the description. We're coming out with all kinds of free resources to help you take care of your health. We have a free screening checklist. Make sure you're caught up on all your cancer screenings. both in Canada and the US. So be sure to check that out. Let us know what you want to hear about next, and we'll see you next time.